Well, so we know we're in the middle of the longest and deepest financial squeeze in NHS history, and the way that we like to explain it is, broadly speaking, demand and cost go up by 4% a year. NHS funding since 1948 up until 2010 has been going up by about 3.5% a year, but we're now in this kind of 10-year, potentially longer period where effectively we're looking at funding increases of just between 1 and 1.5%. So there's a big gap between the amount of cost that's going up and demand that's going up, and funding just not keeping pace. So you can just see wherever you look in the NHS, there's a real squeeze. There's a real squeeze on capital. There's a real squeeze in terms of not being able to, up to now, have been able to afford to pay the staff in the way we would want to, and we just know there's not enough capacity in the NHS. So effectively what you've got is that funding squeeze is causing real problems for the service. So we know there's going to be huge operational pressure over the next 12 months. I mean, if you look at what's happened over the recent winter that we're just coming out of, what you've seen on the ground is trust leaders telling us that they're really struggling to provide the quality of care that they know they should be providing, and they know that they would want to provide, for example, for their own, wife, daughter, son, whatever. So there's a real operational challenge, particularly exacerbated by the fact that we've got some very long-running, large, persistent workforce shortages. So there's clearly quite a big operational challenge to provide the right quality of care, to make sure that we meet the financial targets. But I think what you also need to set alongside that is that we're quite rightly being given a transformation task where we need to work together more effectively in local systems. And again, when we talk to frontline trust leaders, what they tell us is there's a real challenge in finding enough management time capacity to effectively both keep the operational ship upright, but also do that transformation task. So in a sense, for me, it's those combination of all of those things that are the real challenge for the next coming year. In an era of kind of scarce resource and lots of pressure, I think it's really important to be clear about priorities. So I think certainly when we talk to trust boards, one of the things they're really thinking about is we can't do everything, so what are we going to really concentrate on over the next 12 months, 24 months? I think one of the things that's very interesting is when we talk to organisations that are coping perhaps slightly better with these challenges, it's very clear to us there are kind of 2 or 3 common themes. One of them is a real investment and focus on staff, and recognising that actually if we don't invest in our staff and if we don't enable them to do the best to their ability, then we're not going to get the quality of care that we want. I think a second also is that kind of recognition of, if you've got scarce management time, how do you kind of prioritise the different tasks in front of you? And then third, I think this growing recognition that whereas we've all been encouraged over the last 10 years to think about just about our individual institution, actually what people are now thinking about is how do I work effectively with local partners in a broader health and care system. So I think for me it's those 3 things: staff, priorities, and working in a local system.